I personally have been in practice for 35 years, and it's really the past 5 years that there's been drastic changes in really the operative outcomes dealing with gynecology.
Dr. Thomas Ebersole, obstetrician gynecologist for the Reading Hospital Medical Group, says that he divides the procedures he performs into 3 main categories. The first is outpatient surgeries.
Outpatient surgeries are your classic, you want to have your tubes done because you don't want any more babies. You're going to have a dilatation, curettage, a scraping of the womb and looking because of bleeding. You have a problem with precancer and we're going to cut out a piece of tissue.
Another common outpatient procedure is called a uterine ablation. By destroying a thin layer of tissue lining the uterus, this procedure can treat excessive or abnormal uterine bleeding.
80% of the patients that I do never have a period again. And the common statement is, if I would have known this was so great, I would have done it a long time ago.
Dr. Ebersole's second main category is inpatient surgeries. Although recent advances in minimally invasive surgeries mean these procedures are much different than in past.
Inpatient. It's really a misnomer. The insurance calls it a 23-hour stay. You stay overnight, but you go home the next day. And in that entity, I do my minimally invasive hysterectomies, surgeries, endometriosis, fibroids, cysts, complicated, more invasive surgery, but I'm doing it through small peekaboos, incisions, and the patients go home the next day.
And this third category is urogynecology procedures. These can be either inpatient or outpatient surgeries, but they are categorized together because they deal with conditions that cross over between the specialties of gynecology and urology.
Third category would be the bladder and prolapse surgery. Bladder meaning you're leaking, you're coughing, you're sneezing, you have to wear pads all the time, or you have feelings that your insides, your internal organs are falling out, dealing with prolapse.
One innovative treatment available for patients with urge incontinence, sometimes called an overactive bladder, is called interstim therapy.
Small incision is made in your back. A small little battery is put in like a pacemaker that the electrical energy blocks the nerve fibers that are going to your bladder to make it contract. So if you're one of these overactive patients that have had failure because of side effects or the medicine doesn't work, it's a last resort, but it's definitely a consideration.
If you are a woman considering any type of surgical procedure, ask questions and make sure you understand what your options are.
My goal is number one is education. I think education is the most important part, and then you, the patient, making the decision what you want to do after you've heard your risks and deciding what's the best thing for you.